This is Daniel Bregman, MD, cataract and refractive surgeon from Eye Health Partners. This is a case of a ReStor lens with lumbar relaxing incisions that I did in late February 2012. As you can see here, at this point in the case, and this is an unedited case except for the beginning part, the rexus, the lumbar relaxing incision, the clear cornea paracentesis have already been done. This has been done using a metal keratome and a capsular rexus forceps. I'm now going to proceed with a Phaco Chop technique using, again, micro-incision instruments. This is a less sub 2 millimeter incision, which carries the advantage of being inducing less astigmatism and theoretically, of course, since it's a smaller incision, a lower risk of infection. You can see a chop there. Impale the nucleus with the Phaco emulsification handpiece and then pull toward that handpiece with the chopping instrument with my left hand. This has the advantage versus a what's called divide and conquer technique of using less ultrasound energy, and with less ultrasound energy is less turbulence and clearer corneas first day post-op. I'm using the left hand to maneuver the nucleus up into the anterior chamber and emulsifying the lens with my right hand instrument, which is the Phaco handpiece, which with an ozzel tip, which oscillates side to side instead of front to back. Again, we're going to impale the nucleus, suction, and then pull toward the nucleus and chop the lens into pieces. You can see that I'm well away from the endothelium of the cornea, and again, this leads to less fluid turbulence, less endothelial cell loss, and clearer corneas one day post-op. Most of the surgery and the emulsification of the lens is done in the iris plane, well away from the posterior capsule of the lens. And now I've inserted the irrigation aspiration instrument. This has a sleeve which allows fluid to get into the eye, and then a little tip at the end which basically vacuums up the cortex. It is important to carefully watch what you're doing here so you don't pull on the lens capsule and inadvertently rip it and tear the capsule, which will lead in vitreous loss. You can see right now there's a piece of cortex stuck to the irrigation tip. I'm using a second instrument to kind of chop that up a little bit so I can aspirate it into the tip. So now I'm going around and removing the soft cortex with this irrigation aspiration tip. The pupil, you can see, is coming down a little bit, occasionally pulling on the iris. Of course, you want to release that as soon as you do that. And getting the last bit of cortex here with the IA tip. What you're going to see me do now is, since the pupil is small, I'm going to take an iris hook and push the iris back a little bit and get a little bit of cortex that's underneath the iris that I couldn't see. You want to be careful to visualize that when you're going under the iris so you don't inadvertently break the capsule. Now we're going to fill the anterior chamber and the posterior chamber of the lens bag up with viscoelastic. I'm going to put in a ReStor lens with a small cartridge. This goes through a 1.8 millimeter incision. Again, a micro-incision surgery, and we're going to go ahead and inject the lens. These acrylic lenses, these ReStor lenses, unfold very slowly in the eye. As the lens warms up, it unfolds, and you'll see me take another instrument, which is an intraocular lens manipulator, and gently push this implant into place so that the implant is in the bag. Again, making sure here that the haptics of the implant are underneath the leaflets of the lens capsule. And we're up to about 4.5 minutes. So you can see that this case from after the capsular rexus and the lumbar relaxing incisions and corneal incisions takes about 5 minutes and 3 seconds to do. The case front to back with the LRI and the corneal incision, the rexus, took about 7 minutes. And here's the end of the case. Well-centered ReStor lens, centralized capsular rexus, lumbar relaxing incision, happy patient. Thanks for watching.